Hello, everyone, and welcome back to episode 47 of Your Birth Bestie podcast. This week, we are talking all about the anatomy ultrasound, what it is, when it's done, what to expect at that appointment, how you can prepare for the anatomy ultrasound, what results you might get, what they might mean, and many other things as well. And I am actually 19 weeks as of yesterday with my third baby, and I have my anatomy ultrasound coming up this week that I am so excited to see baby girl again. But I'm also actually kind of nervous because it's a really big deal and a lot can be assessed of baby at this appointment. And if anything doesn't seem right, there might be additional steps or thoughts and emotions and feelings that come with all of it and different plans. If you don't know already, I am planning a home birth in July. It's my first home birth. I had my first two babies in the hospital. So if something shows up on this anatomy ultrasound where I'm no longer, comfortable or able to deliver at home, that would be a major change in plans. So a lot is going through my head this week, hoping for the best, of course. But I also don't want to get ahead of myself and unnecessarily worry either, but just want to be transparent with you that it is normal to feel a little bit uneasy or uncertain when having a test like this done, because you just don't know what's going to come from the test. But what you can do is you can prepare going into it to limit the nerves that you have and instead feel really comfortable and prepared for what is going to happen. So that's definitely the goal of giving you all of this information for sure. And if you're also planning for your birth coming up soon and navigating pregnancy with any questions or concerns, or would just love to have continuous support with some mom friends and, people like myself, a midwife and a birth educator, I would love to invite you to join our small virtual pregnancy support group starting next week. It includes 12 weeks of Zoom coaching calls with me, access to my online birth course, Fearless Birth Academy, as well as additional evidence-based resources and online community access. It's really so much great information and some personalized support from myself to be sure that you are 100% confident and feel really prepared throughout the rest of your pregnancy and going into your birth experience. So for more information, if you're interested and to save your seat, head on over to bethconnors.com/group support, or the link will be in the show notes for you to click as well. Hey there, I'm Beth Connors, a midwife and mom of two, but also your birth bestie. In this podcast, we'll dive deep into everything you need to feel confident, prepared, and in control, from baby bump to delivery room, from practical tips to personal stories. We'll cover it all so you know exactly what to expect every step of the way. Let's get into it. So let's talk about exactly what the anatomy scan is, when it's typically done, and why it can be an important test to monitor your baby's development if you choose to schedule one. It is not something that is at all required though, but most moms do go ahead and schedule this ultrasound, but it's totally okay if you are not interested in this test for any reason at all. The anatomy ultrasound is a test to look at your baby's development around 20 weeks or so and assess their growth and overall well-being, and it can also detect any potential abnormalities or concerns. The person doing the exam won't be your typical OB. It will actually be a trained sonographer or an ultrasound technician who will look at your baby completely on ultrasound from head to toe. You will be asked to lie on an exam table while the ultrasound machine is used to take pictures of your baby, and they'll put a special ultrasound gel all over your belly that helps the ultrasound probe glide smoothly and also makes those images that they're getting of your baby super clear. They'll then move the probe gently over your belly, and different views of the baby will be able to be seen with that probe. And this is where the doctor will eventually be able to read these images and give you your test results. Throughout the scan, they will take a lot of different measurements, including the head circumference, abdominal circumference, femur length. They'll also measure your amniotic fluid levels. They'll estimate the baby's weight. The position of the placenta can also be determined, and you can actually see that on the screen. They'll also be able to tell you what your baby's gender is if you want to find that information out, if you haven't already, and also many other things they will go over with you as well. They'll also examine the baby's organs, all of their limbs, their spine, and they can also see the baby's brain to ensure that everything is developing as it should. So really at this appointment, you'll be meeting with just the sonographer, and sometimes you will actually meet the provider afterwards to go over your results, but this isn't always the case. And I wanted to talk about this more in a bit as well, but you might have questions during your ultrasound that your sonographer is the only one present, but they're actually unable to answer questions about the things that they are finding because they are not trained to diagnose or to inform patients of anything that's going on with themselves or their baby. Their job is really to take the measurements and the pictures on the ultrasound for the doctor to then interpret, and then they will be the one to go over those results with you. So it may be a little bit disappointing in that way, but legally they are not able to share any information other than, of course, showing you the pictures of your baby, maybe pointing to the picture of baby's heart, baby's heart beating, or, a picture of your placenta, kind of commenting on maybe where your placenta is or how baby is moving around, things like that. But they aren't actually able to go into detail about certain things, even if they are very experienced and they do know something is maybe there that they're seeing that could be maybe concerning or completely normal. They are not really allowed to say anything either way. So can be disappointing, but just so you have a heads up beforehand. The information that they are looking for helps detect any issues early on. So you're only halfway through your pregnancy. There is a lot of time for you and your healthcare team to address any concerns that might be had from this test result, and then go ahead and plan for any necessary interventions or treatments that you can actually talk about now that will happen either in your pregnancy or later on at the time of delivery. So it gives you lots of time to prepare. And this is also a bonus of getting this test done if that's something that would help you to plan ahead. So basically, information is given to help you make informed decisions about your care and your baby moving forward. So some people are okay not knowing. Others want to feel reassured or plan ahead in the case of an unexpected finding that would then change how they would progress throughout their pregnancy and plan for their own birth. So this is absolutely up for you to decide. If you have already decided that you want to schedule this ultrasound, I do recommend that you schedule it right away when you establish care initially in that first trimester, just because it can be hard to get an appointment if you have a busy schedule or your clinic is really busy. This is a time-sensitive test that's usually done between 18 and 22 weeks. So there is, a couple weeks of a window there, but depending on your flexibility, sometimes it can be difficult to schedule. So something that you can plan ahead of time. And then once you do schedule your appointment and you're anticipating that appointment coming up, there are a lot of ways that you can plan for your anatomy scan to help you have a really good experience. So one thing that I hope you are already doing is drinking a lot of water to stay hydrated. And this can actually also improve the clarity of those ultrasound images. So it can be a really important part of getting a good view of baby and checking on baby head to toe like they're going to do. You may also be asked to drink a few glasses of water before your appointment to have a full bladder. That can help position baby for better visualization. It kind of just depends on the clinic. I've heard different providers or different clinics requesting different things. So in my experience, both of my previous pregnancies, my babies did not want to cooperate at all for their anatomy ultrasounds. So for whatever reason, they were always super low in my pelvis, and they gave the ultrasound technician a super hard time in finding all of their structures, especially the heart for some reason was really difficult for them to find on my second daughter. I actually had to redo my anatomy ultrasound with her because they could not get the measurements and see what they needed to see. So they had me come back the next time with a full bladder because they were hoping that would help a little bit. So a full bladder can be good. They may ask you to then empty your bladder if that wasn't necessarily the most helpful thing, and they're still having trouble seeing things. So it gives them a little bit of opportunity to see baby in different ways in your belly. So it can be sometimes a challenge. They may also have you get up, walk around, and move a little bit to see if your baby will go into a different position and kind of uncover whatever it was that they were trying to assess in the ultrasound. So this is why the appointments are typically scheduled for about 45 minutes, but they can be done sometimes really fast in about 20 minutes or 30 minutes if your baby is cooperating and getting all those views seen. You just really never know. Also, emotional preparation for your anatomy ultrasound can be really helpful. Like I mentioned before, it's really exciting to see your baby. It's a bonding experience to get a sneak peek on them in your belly, but it can also be really nerve-wracking. So taking some time to address those things that you're feeling and manage those emotions beforehand with your partner or with somebody that you can talk to that can help you feel more relaxed leading up to this appointment is really, really helpful. It is so common to feel anxious while you are anticipating what's going on with your baby, but focusing on getting to see your baby and having the ability and the opportunity to address any concerns early on if needed, that might be best for your baby or for yourself. It's probably why you scheduled this test in the first place. So I like to look at it as we are getting more information to make the best decisions possible moving forward to have the best outcome for both mom and baby, and trying to think of it in this positive light rather than being anxious and anticipating, the worst of cases happening. And then once you have your ultrasound and it's finished, your healthcare provider will review the images and the measurements that are taken and all the pictures, looking for any concerns. Like I mentioned before, this is sometimes done at the time of your visit. However, many times the doctor doesn't have time to look at them, or however they do their scheduling, and somebody's not there to look at them right away. They will send you your results later, maybe a day or two later. It really just depends. But it can be really, really hard to wait for these results if this is the case. So I do have moms all the time reaching out to me who get their ultrasound results on their MyChart notifications, and they get the entire report online, but then the doctor hasn't put in their messages or the findings yet, or a summary of what everything means. They are waiting to call them back, and give them more information, but that doesn't happen all the time right away. So then the patient is left with all of this information that they just aren't sure what to do with. So they're trying to maybe Google every single value, seeing if things are normal or abnormal, and just trying to make sense of it on their own, which can just be really, really stressful. So if you have this access and ability to look at your MyChart and get these notifications, just know that sometimes there isn't great information on there, whether things were normal or abnormal. So you don't want to freak yourself out if you don't have to. So maybe waiting until their message comes through or until you get a call from the doctor rather than Googling every single thing to freak yourself out. And I know that's something that I would do. I would try not to do it, but you're going to do what you're going to do and do what's best for you. But I just wanted to let you know that sometimes it does take a few days for those results to come through. And most anatomy scan results do come back normal, so they are very reassuring. So try not to stress yourself out if there is really no reason to worry. And it can be very difficult in pregnancy, but that's the best advice I have for you, is just to try and wait, distract yourself with something else, and just wait for those hopefully really reassuring results of your baby. And one side note too that I just thinking of too, as we're talking about this and the results that you might see before your doctor calls you back, or just having the ability to see them on your MyChart, is even if you ask for them to not show you or tell you what the baby's gender is, if you're wanting it to be a surprise, they might put the gender in the results on your MyChart. So if you don't want to know, either tell them to not put it on the report. Otherwise you will see that information in MyChart if you use it. So don't look at it if you don't want to know the baby's gender, because sometimes they just accidentally put that information on there too. And that is so hard when, parents are waiting for that special moment at the time of delivery, and then it's just such a bummer when it's spoiled at that anatomy ultrasound, just getting the results online. So just wanted you to be aware of that as well. When you do get your results, though, they may either recommend a follow-up appointment for further evaluation or diagnostic tests, such as more ultrasounds, genetic testing, or meeting with a specialist. There are always, just the recommendations that they are going to give you, but you can do what you want and what you feel most comfortable with in terms of follow-up from these results, and really just using the information that they found, if anything, as a guide to navigate the remainder of your pregnancy. So just be sure to communicate openly with your provider and ask questions too about any of the results that you have questions about, what they mean for you specifically. I really always advise clients to ask about their own individual risks and their situation rather than, what's quote unquote typically done or standardly done in the hospital, because healthcare isn't meant to be this standardized thing, in my opinion. It is so individualized, and every mom and baby is so unique, and what they need is so unique. So really taking it as an approach of individualistic and personalized care is so important, and these results are really no different in that. So you have to remember too that the anatomy ultrasound can detect many potential issues, but it's also not a guarantee of a problem-free pregnancy or birth, and the results are not always 100% accurate. So some conditions may not have been detected or be able to be detectable on ultrasound, while others may actually develop later in pregnancy, and they wouldn't even have been found at 20 weeks. So regardless of the results, I hope you have chosen a supportive healthcare team to help you every step of the way and provide you with all the necessary care and the guidance that you deserve. Thank you so much for tuning in today, and I hope you have a great anatomy scan experience if you opt to schedule an appointment. Staying informed about what each test in pregnancy is, what to expect, and have someone to ask questions to every step of the way is so helpful in having the absolute best experience possible. I know a lot of times moms don't feel comfortable asking questions or maybe feel rushed at prenatal appointments, or they don't know what to ask or what they should even be thinking about. All of those things are completely normal and what I see so often, and why I created my online pregnancy support group. So please don't hesitate to reach out if you would love to learn more about how to have a smooth pregnancy and birth experience, how to reduce any worries or concerns, and prepare for your upcoming appointments. Create a birth plan, learn how to breastfeed, and have a good postpartum experience with this new little baby to care for. So there are so many changes that pregnancy and birth bring physically and emotionally and mentally, and I would love to be a resource for you as a mom who has done it twice before, who has helped hundreds of moms through their own journeys, and I'm also doing again alongside of you, planning my third birth in July. I'm actually so excited about giving birth this time around, and I would love to share my confidence and tips to enjoying this experience if maybe you are feeling a little bit freaked out. Please remember you are not alone, and it's okay to ask for help when you need it. If you'd like to learn more about my support group, you can go to bethconnors.com/group support or send me a message and we can connect there as well. Thank you again for being here, and I will see you again next week. Bye, everyone.